Hello. I am Dr. Mizunaka of Longevity Japan. This channel will explain a variety of topics each time with a medical theme. Please subscribe to the channel. In the previous video, we discussed exercise therapy. In this video, we will discuss medication. Currently, a variety of medicines exist for diabetes mellitus. Insulin, SGLT2 inhibitors, DPP4 inhibitors, biguanides, SU drugs, thiazolidine, GLP-1 agonists, and alpha-glucosidase inhibitors. The effects vary in their use, but there are so many that it is almost confusing. Human insulin has been successfully synthesized artificially. As explained in the previous videos, insulin is the only hormone that lowers blood sugar. Although it is very effective in lowering blood glucose, the technique is complicated because it is injected subcutaneously. Also, if the injection amount is incorrect, hypoglycemia may occur. Depending on the duration of action, some formulations are injected once a day, while others are injected multiple times. It is advisable for insulin users to check the duration of action of their insulin. SGLT2 inhibitors are relatively new drugs that are attracting a lot of attention. It removes sugar from the blood out of the body by excreting it in the urine. Calculations show that roughly 200 kilocalories of sugar is excreted per day. Since the amount of urine increases due to osmotic pressure, dehydration must be taken into account. Also, since sugar is excreted forcibly, care must be taken to avoid hypoglycemia. Diabetes mellitus causes a decrease in kidney function. This SGLT2 inhibitor is said to protect the kidneys and is therefore highly anticipated. The body has substances that enhance insulin secretion, such as GLP-1. DPP4 breaks down these substances. Therefore, DPP4 inhibitors increase insulin secretion by interfering with the function of DPP4. Since DPP4 inhibitors act only when insulin is released, they are less likely to cause hypoglycemia and are easy to use, even for the elderly. Biguanides inhibit gluconeogenesis that occurs in the liver and also improve the effectiveness of insulin in skeletal muscle. It is very commonly used in the treatment of diabetes. Its price is relatively low, partly because it has been in development for a long time. It is used not only for diabetics but also for obese people. SU drugs force the pancreas to secrete insulin. Because of their strong effect, it is important to note that they can easily cause hypoglycemia. They also make the pancreas work harder and increase insulin secretion, so long-term use can cause pancreatic exhaustion. If the pancreas becomes exhausted, it will be unable to produce insulin even if it wants to. Because of these characteristics, the use of insulin has become less common in recent years. Thiazolidine has effects similar to biguanides and improves insulin resistance in skeletal muscle. Since it does not act directly on insulin, it is less likely to cause hypoglycemia. Side effects may include edema. GLP-1 agonists are drugs that have received increasing attention in recent years. They are used for obesity as well as diabetes. They not only promote insulin secretion and lower blood glucose, but also act on the central nervous system to reduce appetite. There are drugs that last for 2 weeks after a single injection, and there are also oral drugs that can be taken orally, allowing you to choose the one that best suits your lifestyle. Alpha-glucosidase inhibitors interfere with the enzyme that breaks down sugar and makes it easier to absorb. This reduces the amount of sugar absorbed from the diet. As a treatment for diabetes, they are small and effective but very safe. The unabsorbed sugar becomes food for intestinal bacteria, which can lead to increased intestinal gas. How was it? In this issue, we explained the drugs used to treat diabetes. Diabetes is commonly treated with a combination of several medications. Early detection and early treatment are important for any disease. Longevity Japan provides information on medical checkups and regenerative medicine in Japan. At Longevity Japan, we offer medical tourism to Japan. We focus not only on medical checkups but also on regenerative medicine. If you are interested, please contact me by email. Our doctors will create the perfect plan for you.